there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Hello, Megan.
Hello. We are back.
We are back. Well, happy June, everybody. It is Men's Health Month, and we're coming at you with some men's health nuggets that we think sometimes get overlooked. And we are recognizing that a lot of times men avoid discussing pelvic or sexual health, and rightfully so. A lot of times as females, we've had babies or we're in the gynecologist, or there's just a lot more narrative around some of the more personal parts of our lives. And a lot of times, I mean, I don't know about you, Megan, but my husband doesn't hardly even go to primary care. They just are doing their thing for a while. And so when things go wrong, it can be confusing, and especially when things go wrong with pelvic or sexual health. And so a lot of times shame or embarrassment or awkwardness or unknowns, assuming the worst maybe, or fear of what could happen, then delay treatment.
Mm-hmm.
The internet sometimes too just creates misinformation and panic. And the internet's great, but sometimes Googling at 2 a.m. in the morning is only going to make things worse. And so we are looking at the sexual health as part of our overall health. For women, the fifth vital sign is our menstrual cycle. And for men, it can be its erection. It's their ability for erection. And so we're going to talk about something called hard flaccid.
Yeah. And I think just piggybacking that, Roxy, we are also seeing kind of a lack. I mean, the hope is that it's improving, but even our male patients going to the urologist and maybe sharing some of these things, we're still forgetting that pelvic floor therapists exist for men. And so we get told often that maybe the urologist or doctor, it's kind of like they say things to them that's the equivalent of what women are told when if you have painful intercourse and they say, oh, just go home and relax, have a glass of wine. They're saying similar type of statements to men and not recognizing that actually a pelvic floor therapist would be somebody really great for you to go see. And so let's hope that we can help turn the tide on this, especially in our own communities, that men's health for pelvic health matters too. And I really am hoping that more men seek help and know that there's some interventions. So we're going to talk about something called hard flaccid. And hard flaccid is considered a syndrome. Basically, it's a constellation of symptoms and is significantly associated with sexual dysfunction related to penile activity. So there's little research and currently only theories about kind of the etiology and best treatment approaches when it comes to hard flaccid. But we're starting to the hope is that there's going to be a little bit more, obviously more research on all this, but there was a 2026 systematic review that hypothesized that an initial penile trauma might trigger a cascade of neurovascular and inflammatory events with psychological impact that further perpetuates symptoms. However, it was kind of like a cross-sectional survey. And, this is a hypothesis. And so with hard flaccid, Roxy, do you want to talk about symptoms that someone might experience?
For sure. So it's kind of how the name sounds, to be honest. So there's a lot of changes and fluctuations in erectile function. And so this is when a male's going to try to get an erection, or as they're getting an erection, that erection initiates, but it stops partway and it's only partially erect. And this can then even happen when they're not aroused. So it's like this kind of middle ground or this gray area of, it can be when a man wants to be, even he is aroused, he wants an erection, he doesn't fully get his erection. It can also be when he's not trying to get an erection and it happens. And it's still kind of just this gray area where it's kind of partly there. And so basically there's some symptoms that can then go along with that. So that's the status of the penile tissue, is kind of this in-between
It's like
erection.
in between. Yeah.
Yeah. But some other symptoms then that can then go along with this are also pelvic pain or just a general discomfort with that. Difficulty achieving orgasm, obviously, because there's that middle, they're stuck in that middle ground. And then if orgasm does occur, it can be painful. And we're also seeing that there can be decreased ejaculate or even like a retrograde ejaculate. And so they're just feeling like this fullness, this puffiness. There's a density in the penile tissue and the perineum, but it's not like a healthy, normal erection that's happening that's pain-free.
Yeah. Yep. Like we just mentioned, there's no agreed upon diagnostic criteria, but you can imagine that this will cause some pretty good psychological type of distress when this is happening. And so we don't have this diagnostic criteria. And patients have often undergone significant testing, and that's via ultrasound, cystoscopy, penile Doppler studies, urinalysis, testing of prostate secretions. And there's a lot of frustration that accompanies all these tests because they're often told there's nothing wrong. And when the function seems to be very highly disrupted. So we noticed that some people describe a period of significant stress kind of preceding the change in sexual function or an injury, like we mentioned before in the hypothesis from that study in 2026. And there has been reports of maybe kind of like an overuse or forcing of an erection, even when not aroused. It's not uncommon to hear patients feel quite a bit of concern about like causing the issue. And we will say, I mean, and this has been in our courses, and we've heard this multiple times, that depending upon, porn exposure, that can really play a role in, I mean, we've heard a lot about during COVID times, it can play a role in some of this sexual dysfunction, and it is something to consider. So obviously, if someone's dealing with this, there's a lot of, yes, did I cause this? What did I do? Was there an event? And then when you start to add in all of those thoughts and the nervous system gets in overdrive, it's just like how we see in females. It definitely can cross over and start to affect sexual function.
Well, and I think appreciating like you hinted at the nervous system and the mental health of that, of then all of a sudden, we know that from studies and from just men reporting this in general, that a lot of times this is evidence of their masculinity. This is one way that they just feel like a man if this functions well. And so when that isn't functioning well, then all of a sudden it's like, oh, I can't perform. Not that a guy wants to perform, but that can start to get in their head. And then they think they're broken, and it can feel kind of hopeless, I guess, for lack of a better word. But some of the intervention that it's like, okay, cool, this is what it is, but what do we do about it, right? So let's jump into what we can do it. Megan hinted at this, a multimodal treatment approach of saying, okay, have we done all the testing that would rule out maybe the bigger, scarier things that could cause this? Most of the time, that's going to get ruled out. Like, just to be honest, they're going to do things that look for maybe a tumor or for something bigger there. But those doctors, usually a urologist or primary care, whoever that is going to be part of that team. And then we also are going to pull in a pelvic health therapist, and we'll talk about what we can do on that. But I think we also appreciate like mental health therapists in this as well, and understanding how the nervous system really drives sexual function. And so we want to just be appreciating that it might just be a one-stop shop to correct this. Basically, from a pelvic health standpoint, this is going to sound maybe like what you've heard us say before, and we're going to try to be a little more specific maybe here. But we're going to assess the tissue. We're going to assess the pelvic floor. We're also just going to assess things around the pelvic floor, like the spine, the hips. We're going to look at all those musculature. We're going to correct what we see the problem is. We're going to give interventional exercises that then take what the treatment that we're doing and make it work for this man throughout the week. We don't want him to depend on us to correct these tissues and then him have to just keep depending on us over and over and over again for the rest of his life, right? So we're going to try to correct those tissues. If there's nerve irritation, if the muscles are tight, if there's congestion, there's low blood flow, whatever that is. We're going to do some hands-on work likely, whether that's internal work, external work, and then above and below the pelvic floor like we always do. But we're going to try to correct those tissues, but then we're going to give him tools that take that tissue and try to prolong what that treatment did and try to have more consistent function and pull away from the dysfunction that's happening.
Yeah. And I think in that too, we're going to be doing quite a bit of education, helping, our patients understand what's going on. Again, all the different muscles, men are unaware that they have a pelvic floor. We're going to be working on the nervous system to make sure that we're working on the not overemphasizing performance, like Roxy mentioned. And it's a combination of manual therapies and modalities, relaxation and breathing and movement, talking about general fitness, nutrition, sleep, all of those things. And then, like she said, we're evaluating the abdominal wall, large muscle groups, including the glutes and thighs, hips, and then also the smaller muscle groups. So we've got a muscle called the bulbocavernosus, ischiocavernosus, and those muscles might elicit some findings. And those are pelvic floor muscles. And so we're going to be assessing those and the perineal membrane tissues, and then providing, obviously, the hands-on care here. And then, again, giving our patients something to work on at home and being able to have those tools at home. And typically something like this, it can take a little bit of time, but once the body starts to feel safe again and we can kind of, we also are using the sort of like neuroplasticity in this too, because depending on how long this has gone on for, we can really lay down some patterns of just thinking that like this is just never going to get better. And as you start to work through it, we start to see changes happen. And sometimes it's hard to know each person. But ultimately, providing a safe place for our patients to feel comfortable to share what they're going through and that they feel supported and getting them the exercises that they needed.
Yeah. And one question that we get with this group while we're working on treatment, while we're trying to restore this function is like, should I stop having sex? Should I keep going? Like, what am I supposed to do in the meantime? Right. And that's the hard, that's just, those are hard days to navigate and hard weeks to navigate, of like, this is where I'm at. This is where I want to be now. And even if the patient understands this is where we're going, it's like, okay, what do we do in between there? Right.
Mhm.
If you're wondering that, or your spouse, you're hearing this for your spouse, really thinking about, does attempting an erection and then the potential of that failing, does that really bring him down? Does that get in his head more than it's helpful? Would telling him to stop be a relief, or would telling him to stop be defeat? And so really there's not a black and white answer to that. If you're wondering that for you or someone that we promote whatever, but I think we have to appreciate that if over and over again, the attempt with what is seeming like a failure at the end of it is just like wearing him down, then maybe we do need to step back from that and pause and take the pressure off of him to try to make that happen when it's not happening. But some guys are like, no, I'm going to keep trying, like I don't like it. Obviously I want to get over this, but it's not wearing me down and I appreciate the attempt, or I have partial function and for right now that's good, but I just want to correct it all the way. So I think really asking that question of, is continuing in this in between and this dysfunction, is that helpful or is that hindering the person? And then making a wise, educated choice from there, just based on what kind of gut feeling or what we're observing is typically how we would answer that, in case anyone is wondering.
Yeah. Yeah. So again, lots of nuance with this, and there's not a lot of conversations happening around this. And so hopefully this is just like hopefully one of multiple episodes where we talk about just some different common diagnoses that we can see in men's health. And just a little introduction, and send this to if you know anybody that's been dealing with this. And then again, in your area, if you're looking for somebody, you can always shoot us a message, and we can try to get you to the right websites to be able to search and see who is in your area that can help with men's health, pelvic floor therapy.
And I just want to throw in there, we love your questions. So if you have questions, definitely don't hesitate because that helps us know what you're interested in. And we'd like to speak right into people's lives, even if it's from a distance on this platform.
Absolutely. All right. Well, hopefully this is helpful. And until next time, we'll keep the conversation going. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.